My name's Deb Adams. I'm the registered home manager of Bracebridge Court care home in Atherstone of the West Midlands. So Bracebridge Court is a residential care home for elderly people living with dementia. We have 66 bedrooms in Bracebridge, and we started with the Dock at Home system in November 2020. We've got 2 Dockabo tablets, one on each floor of the home, and they are accessed by all the senior team as and when needed. As new residents enter the home, I as the manager access the online portal and register them, and that enables the staff immediately to have that access if needed. So pre-COVID, we would, if we had a concern about any resident, we wouldn't take readings. We're a residential care home, so that wouldn't be the norm for us back then, and we would phone a GP as a first point of call. During COVID and the pandemic, that was quite limited, having access to GP surgeries. So once Dockabo, which is why we embraced Dockabo, because it enabled us to have that direct link electronically rather than over the phone, and know that somebody was going to be in touch to turn up and have a vital input with residents. So as a norm now, we do take vital signs. So we will do the blood pressure readings, weights, temperatures, the optimizer, and that goes direct to the clinical leads. The seniors, once a month, put all the readings for every resident on the system, and that is managed by the hub. But then we do, as and when a person becomes ill, so if I've got a concern about a resident, possible got an infection, we would put it on the system, and within 2 hours a clinical lead will be in touch with us. I will talk through all the residents that are having input on the virtual ward, and she will sometimes ask us then, well, can you do some signs, photos, and we can then input that information for her there and then, and she's got it as we're talking.
So my name's Kim, I'm a clinical practitioner. I work for South Warwickshire Foundation Trust, and I'm the clinical lead for Dockabo. So the care homes will complete a monthly wellness check. The place-based teams that complete the virtual ward rounds will monitor the monthly checks. They will keep an eye on the residents. Anything that flags up, they'll follow up with the GP. They'll raise it to either myself or somebody who they feel is most appropriate to deal with it. They also complete deteriorating resident question sets. So if they've got a patient that they feel is clinically unwell or acutely unwell, they'll complete something which sets an alert, which is monitored by trained nurses in a call centre. They'll triage it and then send it through to a clinical practitioner to respond to. So I will usually respond to alerts that are frequently coming through from care homes. Currently the hours are between 8 AM and 8 PM. So the care homes will get a response between those hours. They are free to complete their observations anytime, but deteriorating residents will get a response between 8 AM and 8 PM. So the alerts will come through to a central point of access. They'll come through, a deteriorating resident will come through as an email. It will be responded to within 2 hours. A clinical practitioner will then visit within 2 hours if necessary. The alerts that come through from monthly wellness checks will go through to the place-based teams that are working on the virtual ward rounds, because they're not so urgent. They're not generally somebody that's clinically unwell. It's just usually a high blood pressure or something that's flagging up a little bit of an irregular heart rate, which will then be followed up.
It is an added job to seniors' day-to-day tasks. But it has reduced the time they spend on the telephone going through the hub, which can sometimes take 10 to 20 minutes. Whereas on the Dockabo, you're literally doing all the readings, putting it in the Dockabo, and you wait for that call back. And normally a call back comes within 2 hours. They're feeling empowered in knowing that residents are being seen to in a more prompt manner. And when they're doing the urgent requests, it's quite quick.
So we started taking temperatures when COVID broke out, so that was one of our signs of seeing if any of the residents had COVID at the time, and then obviously the Docker home come about, and now we do regular blood pressure readings, oxygen levels, and temperatures as well. We do it on a monthly basis where the general questions come about, and then if we do have like an issue where we think someone needs to be seen straight away, then we put all the information on what the problem could be that we think it is, or signs that they're showing, and then the Docker home responds within 2 hours for the right care that's needed for the resident. Have you taken all your medication today?
Yes.
So far?
So far, I've got some more to say.
Have you had your fluid intake for today? You've been drinking the same, yeah?
Yeah.
Not showing any signs of a fever, are you? Fever, chills? You in any pain?
No.
We have the monthly residents that come up for the monthly reading. So if I'm on shift on that day, because it's split on 2 floors, if I'm on, say for instance, on the ground floor, I will do a couple of out of that. So it kind of gets split up over the few days, so they eventually all get done. If they notice that the readings weren't right, then they will contact, they might phone us to say, right, can you do some more readings? Or they will send a nurse out to come and do observations on the resident. So it is good because you can, with the Docker home, you're expected to receive a phone call within 2 hours. Sometimes it's quicker, and then they can provide the right care that may be needed for that resident. So you're not on the phone in queues or anything to doctors.
The senior care team leaders always took the lead in calling the GP. So the Docker hasn't changed that, but I do think it, having it logged has meant there is a better trail of information asked for, given. I mean, it has definitely reduced hospital admissions, we feel. We feel that now we get quicker input from medical practitioners, and it's reduced residents getting poorlier and ending up going into hospital.